Hello there, my name is Carlo Oyer. I am a board-certified emergency physician and I produce medical education videos like this one right here. And today we're going to talk about photobiomodulation or LLLT, low-level laser therapy, and how it approaches hair growth and hair renewal. While I do the video, I'm going to be doing my own LLLT treatment with my iRestore helmet. So what is LLLT? It's basically near infrared waves or light waves that penetrate the deeper tissue. They kind of spare the surface tissue so it avoids damaging or burning the superficial skin and acting on the deeper skin tissues to stimulate different things. It was first used for medical purposes in 2002 as an attempt to remove hair from unwanted places, and actually is found to have the paradoxical response. It actually resulted in more hair growth. How does it do it? Well, there are many theories on how it does it. Here are a few of the things. Number one is increased ATP. ATP is the fuel of the energy of the cells. It is made in the mitochondria, so it energizes the mitochondria in the skin and therefore increases ATP and increases energy to the skin of the scalp area. It also modulates the reactive oxygen species or free radicals and things like that, and creates an anti-inflammatory effect on your scalp. And that anti-inflammatory effect does seem to improve hair health and regrowth and so on. It also is supposed to increase blood flow to the area, which can affect the hair follicles and therefore result in better hair growth. The advantage of this type of treatment for hair loss is that A, is non-invasive. You don't have to do, punctures. You don't have to do needles or injections. You don't have to take medications. It's totally an external form of treatment. Number two is safe because it has been studied for more than 20 years. It's now being used for other things like skin treatment of other conditions, for nerve pain and other things like that. But specifically for hair growth, it has had the FDA clearance and approval for use. And it acts synergistically with other methods of treating hair loss. So if you want the ultimate effects, you can also use oral or topical medication to help your hair growth. However, the studies have been done comparing one like pills and things like that, lotions, versus using this non-invasive LLLT therapy, and the results are very similar or even better. And it's non-invasive. You don't have to put anything inside your body, especially somebody like myself who might be taking other medications. You don't want to introduce another drug into your system. This is definitely a good alternative. A quick search in PubMed shows that the role of LLLT in androgenic alopecia was studied in 2021, and it showed positive results. In one study by Kim et al. In 2007, they looked at the scalp of different patients by global photography and trichogram. Tricho stands for hair. So they do these very close-up pictures and they count the number of hairs, follicles and hairs coming out. And they compared at the beginning of the study, 14 weeks later, and this showed a statistically significant difference in the amount of hair follicles, of hair, actual hair growing, but also the thickness and overall health of the hair. It was shown that it shows more regrowth, thicker hair, the scalp tissue look healthier, and even the hair was shinier by using phototherapy. There was a double-blind study by Lanzafame et al., and this used a helmet LED, very much like this one, but this one's actually LED and laser therapy both. And it showed using this type of therapy every other day showed a 35% increase in hair growth. Studies suggest that the effectiveness will depend on a minimum amount of hair. Of course, if you are completely without hair or bald, then there's less likely it might do some good. And if you have thick hair or have a lot of hair sitting down, then the phototherapy can't penetrate. And this is why parting your hair with a comb or changing it around will improve the absorption of the laser. And you want the laser to be all around your scalp, so it stimulates your whole scalp, not just the top, not just the back, but all around to have an effective photobiostimulation. This particular device is called iRestore and is an FDA approved device. That means it's safe and effective, and it has been shown in clinical trials to be effective, and compared to placebo, it will give you a benefit. This particular helmet is medical grade, both laser and LED lights shining up on your scalp and stimulating in two different ways the skin, follicles, and so on. It provides a wide coverage range. It goes all the way on the top and all the way in the back and even on the sides. So some of the other devices might be a band or a brush and you have to like move it around. This one, you just basically put it in. It has like a nice fitted rubber thing and it just stays there. And right now I'm not even hooked up to any wall. I have a battery pack in my pocket that is monitoring the time. And already in the time of this video, I've gone through 5 minutes of treatment. For a total of this particular device of a 12-minute therapy. There are other devices in iRestore that are different time lengths, and also because they have different amount of lights. This is the elite version, the most powerful or medical grade one that they have. And this provides 3 different red wavelengths to stimulate the scalp and growth. It does come with a 12-month money-back guarantee. So even though it's a big expense initially to get you started, it will basically guarantee that you'll get some results in 12 months' time. I plan on doing another video talking about other ways which LLT, low-level laser therapy, helps hair growth and such videos in the future. So stay tuned for that. But for now, let's do a review of what comes in the box and what you expect to find in the iRestore helmet. So let's do an unboxing of the iRestore Elite helmet. You can see the box. It comes packaged in with some extras other than the helmet. These are the gummy multivitamin, and you want your body to have all the nutrients necessary to build new hair as you start your hair regrowth journey. So they include, among other products, the gummy bear vitamins. This is a battery pack. That way you charge it, attach to the wall, but when you actually going to use the product, you attach that to your belt, you carry it around. That way you're not tethered to the wall, but you can move around, do whatever you need to do. The helmet attaches very firmly to your head, and you can continue to do your housework, move around, office work, whatever you need to do. The treatment only going to take 12 minutes, but this is the extra. You should definitely consider getting these. This includes a shampoo, a conditioner, also another multivitamin targeted at decreasing DHT. Let's go through it here. What is this? This is the special serum. You apply that, or hair growth activator. You apply to your scalp after you're done with your hair routine, and you leave that on. This is an DHT blocker formula, or a pill you take every day to decrease the amount of DHT, block it, improve the anti-androgen effect. And this is a conditioner, also, again, improving your overall scalp health, has nutrients and other things like that to help you, and the shampoo. So all together, shampoo, conditioner, the serum, this special comb to separate your hair, especially to the areas that you want the light to go into better. You part your hair so that the light can get in there well, and then you can get your treatment done. This is the actual Elite iRestore helmet, and beautifully boxed, covered up. You can see a drawing or a schematic of the helmet, and then we're going to open up that box. And the box itself contains some educational materials there that you can read through. And for example, it tells that it includes the Elite Restore helmet, the power adapter, the controller, user manual, carrying case, accessory bag, and other things like that. It also provides some education about different patterns of hair loss and who is this helmet best for. Obviously, as discussed before, you want to make sure you have some hair, but not too much hair. you want to have enough that you can activate and grow and stimulate and encourage the growth, but you're not completely bald. You can see it's FDA cleared, has 500 diodes. It's a 12-minute treatment. It's non-invasive treatment like we discussed before. And this is the actual helmet. And again, beautifully packaged, FDA clear, reminding you it's a good product. This is like medical grade or spa grade treatment. This is a nice carrying case to protect the device and be able to carry it around if you're going to take it out on vacation. You're going to transport it to, I don't know, a place of work, and you're going to use it there for 12 minutes or whatever. Of course, the iRestore manual, that'll tell you instructions on how to maintain it, how to clean it, how to take care of it, how to use it, and so on. Let's unzip this baby and open it up and look at the helmet itself. And there it is, the Elite iRestore with more than 500 diodes. You can see it's tethered to a cable, and this is a controller. It tracks your time. It starts a countdown from minute 12 down to minute 0. It attaches a little battery pack, and then this little pouch contains the charging cables to charge the battery. So you can see you have everything you need to carry it safely and protect it. You can see the helmet upside down there with all 500 different lights, and these are different between lasers and LEDs. It contains both. And this is me prior to doing anything. And you can see a little bit of thinning back there, not too bad, but it's mostly because my hair is overgrown and that kind of covers it all. You can see there what my daughter calls the skin horns. That side's not too bad, but definitely thinning there. And this side is a little worse, a lot worse, I should say. And it's very thin on the way up. And this is us having fun. My daughter is going to basically cut and trim my hair really well so that we can see how this thing works. Okay.
No, I got pink. Oh, more.
So
Wait, do I do it in stripes?
you can start like this.
And
And
like
then
I said, stripes.
You're like halfway, like so that this halfway.
Oh, okay.
Don't
take his ears off, Bella.
Oh, see, recording at pool. All right. So
We're gonna do this.
well, you turn on, and then you're like this, like
Just hold that. Keep going.
I'm slowly keep moving up.
Okay. Let's get our getting on.
Don't go up too quick. You want to make sure you get it like even.
Wait, I want to do that scene from the green. Oh my goodness. You look fine.
And then it's that's it.
Well, you got one. Yeah. Golly, you understood the lady. Well, I saw this up.
Get in. Keep going.
All right.
Let's do it.
It's just a
Hair's not. I've had worse hair.
Really like this?
You should get a mohawk. Do a mohawk.
Yeah.
Sure.
I don't like the.
Hey.
Not it's been a whole coming.
Wow.
1250.
You're like, oh. You're like, you were I would do it. I could do it. You are. That sounds like a girl. What? Hold on. Kate. All right, keep going. Yeah, you need to do this here.
Sure.
Oh. It's a I say,
I didn't write each other.
you
Full out.
feels shorty.
Yeah, I can really see the skin horns. That is my suit. It's that fat. Sorry, I'm sorry. Just get on to be so taking forever.
Yeah. Come on.
I hate it. She
This is the easiest haircut you'll ever get.
was in my ears now. Hey.
Yeah.
So
Is it coming out? Feel stress.
It's the best to see and heal it.
Just here. Rack is like, nope. You're not studying. Come on.
Yeah.
It looked like it's fart.
Yeah.
Yeah, nice. Dang. Did it even?
Isn't that my first time?
Yeah, you didn't eat the back.
Oh,
Yeah.
like upwards?
Oh my goodness, look at all.
I know how I'm getting that. I didn't know it's to go upwards.
That gets so.
You gotta go even.
I know.
Can't leave me a couch. I mean, landscape.
Oh my goodness. You look old.
Yes?
I thought that fast. That's the reality. Are you recording with all of us that you say? Yeah. You're not free, but I can look at it for the system.
Yeah.
It's just you look realistic. Then I'll like with someone. So often. Then I'll look at someone at the place.
Seems alright.
See the lights, like you can actually see what you're doing. You want to get it all off?
I think it's off.
You have a patch right here.
A patch missing or a patch? Yeah,
Patch missing.
that's from the horse.
It's a line.
Yeah, it's my scarf from the horse.
Right? In last year.
They don't want to grow like Matt.
Straight.
You're missing it. Come down for it. Go to the office, especially your head. Two things. How? No, it's if you're not going to send a pink like you color it is there's by smarter. She tried to use the clouds up.
No, I need some shots.
Oh.
Oh,
What? Oh, oh.
I haven't seen it.
You can even there.
I
don't have a
It looks like mine.
Oh. You don't have to.
Okay.
I know.
What?
What I swear now. You have
Just store this though.
They're not. There you go. And you can see they're missing out.
never that. The helmet with LEDs in it. Now it's a black bag. The brown black. Oh, over LED. It's your turn. At least you'll be able to give a good, honest review. Ever. I don't like that. Why? The good thing is your head's pretty symmetrical. Y tiene como un pico aquí para el frente.
What's in the mix?
No, it's bad. Why are you trying to work hard? And whatever was her best.
For that is, I'm gonna grow it.
Dad, I just barely I can do 20 minutes without her. I barely could.
So yeah, this is the me for January 1st. And yes, I did cut my hair really, really short. So that way I can truly see how this iRestore helmet, the shampoo, the vitamins, the DHT blocker, the whole kabaj works for me with the every other day use, and see if I can grow hair in the 14 weeks as promised. I am very excited I'm very optimistic that it's going to work. And this is why I did this, so that we can truly get a real comparison of the before and after and see how much better my hair looks 3 months from now. So I hope you enjoyed the video. I hope you learned a lot about hair growth, the use of LLLT therapy, and hopefully we'll share a few more videos. Make sure you share and save it so you can see the updates as they come along, maybe every month or something like that, some other education about hair loss and medications and so on. So thank you for watching this video, and we'll see you soon.